All the way from the Netherlands, we have Bas Hoefman. So please welcome to Sweden, and could you introduce yourself and your company?
Yes, thank you very much. My name is Bas Hoefman. I'm a co-founder and director of a company called Text to Change. Back in 2007, I learned about the enormous growth of mobile technology in Africa. I was at that time working at a bank, and I thought, if so many people have access to a mobile phone in Africa, why don't you use it for health education? Why don't we use it to reach out to people with important health messages in order to communicate to them, but also to educate them? I did some research on that, and I shared it with a friend of mine who has his own ICT company. And we realized that it wasn't done the way we pictured it. So we didn't want to impose messages, but we wanted to send a quiz question to a large group of people, and we wanted to be interactive, so people could send back their answers and win airtime. A very simple form of edutainment. As I said, it wasn't done the way we pictured it, so we wrote a small proposal, and there was a pharmaceutical company that was interested in funding it. So they recommended us to go to Uganda. So we've never been there, so we went to Uganda of all places because they had a favorable community there, or they had some partners there where we could work with. They had a subsidiary, and there was a favorable environment in terms of HIV/AIDS. So off we went to Uganda, and we executed our first program there in 2008. And we had an 8%, we had a 20% response rate, and we had more importantly, 40% increase of people going for testing at the partnering clinics. And that really underlined for us the potential of mHealth, mobile health. So we built our own platform and started to connect it to all networks in Uganda, and gradually went to other countries. As an extra form and avail it as an extra form of communication for NGOs, health facilities, development agencies, not only on health, but that's our main focus. So back in 2008 we had more projects coming in, and we did a lot of small projects before it really took off.
We heard some talks before about the fact that there are some potential for mHealth, particularly in developing countries, but there's always the problem of the fact that they die after a while. What are your plans for continuing to work and expanding?
Yeah, that has been a problem, and it's still a problem, of course, as a lot of people jumped on the bandwagon from the start. Like mHealth became sexy, and there's no proposal that was being written without incorporating a mobile component. So there were a lot of pilots that died after a short while, because they weren't designed with scale in mind. So they were just, you shouldn't do mHealth just for the sake of doing mHealth, or just because you have the money. You really have to listen to the end user. You have to listen to the demand. So what do the people really want? What need is there? And then in order, or in view of that, you have to develop your mHealth solutions. So if you reach scale, and we've done that with several programs in Africa, then it's easier to come up with a business model in order to have some sustainability. But yeah, that's still a challenge, because people are not used, or in Africa people are not used to pay for healthcare, let alone for health information. So it's about having very strategic partnerships with content providers, with mobile operators, and with health facilities. That whole ecosystem has to collaborate in order to make it sustainable.
Were you able to meet interesting people, explore new ideas here in Digital Health Days?
Yeah, definitely. It's especially today, it's more focused on the emerging markets of things, but it's also good to see that Stockholm has a very interesting ICT startup community. So it's really great, and I've met with great people from all sorts of backgrounds. So yeah, great.
Would you like more focus next year, probably?
Yeah, it's always good to have focus on emerging markets, so the more the merrier for me.
Mm-hmm. So I will not keep you away from your seminar, and thanks a lot for your time here, and hope you meet more interesting contacts here.
Okay.
And enjoy your stay.
Okay,
thanks
thank
a lot.
you very much.
Thank you. Thank you. So with that, we end our live sending, and we're going to be back after the break. Thank you.